Polio cases are down 99% globally, a remarkable achievement that showcases the power of coordinated global health efforts. However, this success story has a troubling chapter in Afghanistan. In Afghanistan, the fight against polio might be backfiring, raising questions about the effectiveness and ethics of current strategies. A groundbreaking ethical review by Dr. Mohammad Ismail Zubair reveals 6 critical flaws in the current polio eradication strategy. These flaws not only hinder the eradication efforts but also strain the already fragile healthcare infrastructure. Let's break it down and understand these issues in detail. And vote, should we change tactics? The first issue is the overworked health systems. Polio campaigns, while crucial, drain political and policy attention, financial and human resources from other emergencies, and divert national health priorities. This diversion of resources means that other critical health services to address diseases with high mortality and morbidity rates among children and women are neglected. First, overworked health systems. Polio campaigns drain political and policy attention, financial and human resources from other emergencies, leading to overcrowded community health interventions and delayed treatments for other illnesses. Families see vaccinators as more than essential primary care providers, creating a skewed perception of healthcare priorities, but still lack basic care. This imbalance of burden and benefits of the global health mission leaves many without essential medical services, exacerbating health disparities. Second, community burnout. Frequent vaccination campaigns create burnout among both healthcare workers and the community. The constant pressure to participate in these campaigns can lead to fatigue and resistance, as families and communities are pressured and manipulated to prioritize polio over other life-risking healthcare needs. This singular focus can overshadow other critical health issues, such as maternal and child health, nutrition and chronic disease, and indirectly contribute to high IMR, under 5 MR and MMR in the country. Third, data fears. Thousands of DNA samples containing AFP samples are collected and transported for testing to foreign laboratories, including Pakistan Polio Lab. But who owns them? The lack of transparency and consent regarding genetic data collection raises ethical concerns and mistrust within the community and local health experts. The concerns include potential misuse of genetic data, illegal ethnic profiling, unauthorized population studies, or geopolitical surveillance. Would the community trust and support a program that ignores their kids' malnutrition? This question highlights the need for an integrated and more holistic approach to healthcare that addresses all aspects of well-being. Comment below. Dr. Zubair's team assessment recommends to fix this now with fewer campaigns and more essential child and maternal care. By reducing the frequency of polio campaigns and increasing support for maternal and child health services, we can create a more balanced and effective healthcare system. Fix this now with fewer campaigns and more life-saving maternal and child health care. Establish community advisory boards to promote community ownership and participation in healthcare decisions. These boards can play a crucial role in ensuring that health interventions are culturally sensitive and community-driven. To align with ethical standards, PEI must establish a functional in-country genomic capacity. Stop sending AFP samples abroad, adopt stringent data governance policies, and involve communities in consent processes. Gilbert, Degeling and Johnson 2019. Implement measures to ensure accountability and provide support to affected families of slain health workers. Recognizing and supporting the sacrifices of healthcare workers is essential for maintaining morale and trust. Science alone won't win. Ethics must lead. Ethical considerations should guide our strategies to ensure that they are just, equitable and effective. Dr. Zubair's full paper, The Ethical Burden of Eradication, a Population Health Ethics Assessment of the Polio Eradication Initiative in Afghanistan, as published, will provide a roadmap for rethinking polio eradication interventions in the Afghan context. Stay tuned if you want fairer global health. By engaging with this research and advocating for ethical reforms, we can work towards a more just and effective global health system.